The government today put its money where its mouth is as it promised to begin dealing with a major backlog of deferred maintenance at hospitals nationwide. The pledge came in Auckland, where $305 million of urgent work on hospital infrastructure has got the government green light. Our health correspondent Karen Brown was there, and Karen filed this report.
Pomp and ceremony and smiles were the order of the day at Auckland City Hospital this morning when the Prime Minister, Jacinda Ardern, arrived to deliver important news. Auckland City Hospital, the Starship Children's Hospital and the Green Lane Clinical Centre are in for a major upgrade. $305 million will be spent there on upgrading and repairing vital infrastructure: lifts, boilers, generators, switchboards, substations, cabling, tunnels and water systems. Ms Ardern says it's work the public and patients won't notice, but it's critical.
This funding is not for new buildings or extra capacity. That's not what the DHB told us that it needed the most.
The Health Minister, David Clark, says it's all deferred maintenance and only the beginning of a wider facilities and infrastructure remediation program at the hospital. He said it's down to years of underfunding in health and there will need to be other similar investments made in other areas of health too.
The Treasury tells us that about $14 billion worth of work needs doing over the next decade. And so we're working hard to make sure that we've got the capital set aside.
Dr Clark added the work outlined in Auckland today is only the first stage of work needed in the city. He said Auckland District Health Board was unique in the health sector by not only providing care for 500,000 Aucklanders and regional services, but also highly specialised care for the whole country.
All this requires a very large and very reliable infrastructure to support it. Unfortunately, a lot of the infrastructure at Auckland City Hospital and Green Lane is approaching the end of its life or is at capacity. We can't afford to ignore that problem any longer.
The DHB's chair, Pat Snedden, said none of the work outlined relates to earthquake risk, potentially combustible wall panels or rotten walls which have plagued nearby Middlemore Hospital.
Nobody's falling through the floor here. Nobody's falling through the floor. No rotting buildings.
He said the need for the work is down to the age of buildings and equipment, adding they do not pose any risk to current patients. Auckland was well prepared because it had balanced its books for the past 5 years and developed a major business case.
These pipes, this water supply, this kind of commitment to a more sensitised green environment is important because we are one of the biggest players in town. 10,500 staff, 2.2 billion worth of revenue in a year. We have a massive footprint.
In one of the hospital's deafening plant rooms, the engineering manager, Alan Lusick, said pipes dating from the 1960s had to be repaired or replaced, and work has already begun.
It's like at home. You had more power, more internet. The services have a capacity of finite life. So we use a couple different models. There's the economic life, the equipment life, the serviceable life. And it's kind of like putting a Band-Aid on something. You can only do it for so long.
Later on, Jacinda Ardern took the opportunity, on only her second visit back to the hospital after giving birth there in June, to meet other new mothers.
So well looked after?
Yeah, very well looked after.
So how old's your
almost 2. Yeah, so we have a son now. Yeah, a little girl.
In Auckland for Checkpoint, Karen Brown.